Hello everyone, and thank you for joining today's session. My name is Rumit Lepcha, and in this short presentation, I will be talking about goniometric assessment of wrist radial and ulnar deviation. So it is a key component in evaluating wrist joint mobility. So firstly, we have to know about what is goniometry. So goniometry is a method used by physiotherapists and clinicians to measure the range of motion of joint. So it helps us assess how much movement is available compared to it to the normal range and monitor progress during rehabilitation. So focus on wrist movement. Today we will focus on radial deviation and ulnar deviation. So first we have to know which is ulnar and which is radial. So this is radial and this is ulnar. So firstly we have to know radial deviation. So radial deviation means moving the hand towards the thumb side. So or towards the radial bone. So this is radial deviation and this is ulnar deviation. So ulnar deviation is basically moving our hands toward the little finger side or ulnar bone. So this test basically helps in diagnosing wrist condition like arthritis, fractures, ligaments, injuries, or post-surgical infection limitation. So regular goniometric measurement also help to track progress in physiotherapy. So we have one material from which we can measure our range of motions of joints. So the material called goniometer. So basically it helps on measuring the range of motions of our joint. So I will be sharing my research paper here. So this is my research paper. So risk goniometry is a fundamental clinical tool used by physiotherapists, occupational therapists, and clinical to quantify wrist range of motion room, track progress, and make treatment decisions. So here I have chosen this topic from the book Therapeutic Exercise, as you can see here. So this is the book I have chosen from which I have chosen my topic, and the chapter is this goniometer. So this is the test of ulnar and radial deviation range of motion measurement. So at the end of the ulnar deviation room, the examiner right hand maintains the proximal goniometer arm in alignment with the dorsal midline of the forearm and the lateral epicondyle of the humerus. The examiner left hand keeps the distal goniometer arm aligned with the subject's third metacarpal. So I'm going to show you one video which I have measured measure the range of motion of my patient, wrist deviation, that is ulnar and radius deviation. Hello, so I'm going to demonstrate goniometry. So basically, this is goniometer, and what it does is it measures the range of motion. So I'm going to talk about the parts of this goniometer, and this is fulcrum, this is body, this is moving arm, and this is stationary arm. So I'm going to take a range of motion of radials and ulnar. So this is radial and this is ulnar. So let's check her range of motion. Radial. Okay. So her range of motion is 20. Basically, its normal range of radial is 20. So let's check online deviation. For ulnar, we have to use the same procedure as we used for radial deviation. Okay, 30. This is normal range. Thank you. So these are my research paper on radial and ulnar deviation. So wrist goniometry is a fundamental clinical tool used by physiotherapists, occupational therapists, and clinicians to quantify wrist range of motion, roam, track progress, and make treatment decisions. So these papers summarize accepted measurements techniques, discusses sources of error, presents commonly reported normative ranges, reviews reliability considerations, and provides a practical reproducible protocols for clinicians and researchers. Where appropriate, a simple reliability study design and statistical approach are proposed so clinicians can evaluate measurement quality in their own settings. Limitation and recommendation for best practice are included. So, this is my book and it is written by Caroline Kessner. So, this is my book chapter Goniometer, that is ulnar deviation measurement. So, ulnar deviation refers to the movement of the wrist toward the ulna or the little finger side of the hand. This movement helps assess the range of motion room of the wrist joint, an important aspect in conditions like arthritis, tendon injuries, and after fractures. So, I'm going to mention procedures. So, at the end of ulnar deviation range of motion, the examiner right hand maintains the proximal arm of the goniometer in alignment with the dorsal midline of the forearm and the lateral epicondyle of the humerus. Meanwhile, the examiner left hand keeps the distal goniometer arm aligned with the subject third metacarpal. So main points are the proximal arms of the goniometer act as a fixed reference line. It stays along the forearm. The distal arm moves along with the hand during deviation. The fulcrum or axis is usually placed over the capitate bone on the dorsal wrist. This setup ensures accuracy by keeping both arms of the goniometer in the correct anatomical alignment. So, um, thank you. So you can check it out. So you can check it out. So this is the video where I have shown my patient like she was checking her range of motion of her wrist, that is ulnar radial deviation. So the normal range for radial deviation is 20, and for ulnar it is 30. And when I check a range of motion of her radial and ulnar, it was normal. So for now, I'm going to share you one case presentation. So to conclude, I would like to say goniometry is a simple yet vital assessment tool in physiotherapy practice. So accurate measurement of wrist radial and ulnar deviation allows clinicians to design better treatment plans and objectively track improvement. Thank you for your attention.